Okay, let's dive into this. It's probably one of the most common, deeply human questions anyone asks after a cancer diagnosis, right? What can I do? Can what I eat actually influence my cancer recovery? Because let's face it, getting a diagnosis can feel a lot like being strapped into the passenger seat, completely at the mercy of your treatments. It's totally natural to want to grab the wheel, to look for ways you can actively participate in your own healing. And for decades, the answers about diet, well, they were kind of mixed, mostly anecdotal. But today, we're going to look at some absolutely phenomenal, hard scientific data that completely validates your desire for agency.
Welcome to this explainer. Today, our whole focus is on taking complex, large-scale clinical trial data and translating it into actionable, complementary tools for your cancer management. Look, we're not talking about fad diets or, internet rumors here. We're looking at peer-reviewed evidence that proves how an anti-inflammatory lifestyle can be a measurable, truly powerful ally in your standard oncology care. We're here to empower you with the facts.
So here's our roadmap for today's explainer. We'll start with inflammation and how it drives cancer progression, then look at how scientists actually measure the inflammatory potential of our food. After that, we'll dig into the hard evidence for colon cancer, then the breast cancer evidence, and finally wrap up with how to empower your own cancer care.
All right, Section 1, Inflammation and Cancer Progression. Like we mentioned, a cancer diagnosis can strip away your sense of control. But, understanding the actual biology behind the disease, that can really help restore it.
To understand why your diet matters, we first need to understand the battlefield inside the body. We're talking about systemic inflammation. Now, unlike the acute inflammation you get from, say, a paper cut or a sprained ankle, which flares up, heals, and fades away, systemic inflammation is chronic. It's like a light switch that just stays permanently flipped on. And in the oncology world, it's heavily associated with disease progression. Actually, it's considered an independent biomarker of how a cancer will progress. This is absolutely crucial because it means systemic inflammation isn't just a side effect of being sick, it's an active driver of the disease. But here's the empowering part. It is a highly actionable target for you to intervene.
And I really want to emphasize, this isn't just some abstract theory bouncing around a laboratory somewhere. Large, real-world population studies consistently tie these systemic inflammation levels directly to how well patients actually do. Simply put, the higher the baseline inflammation, the more challenging the outcomes tend to be. So, if inflammation is the fuel for disease progression, the next logical question we have to ask ourselves is, well, how much of that fuel are we inadvertently adding to the fire through our daily habits?
That brings us to Section 2, Measuring Dietary Inflammatory Potential. Let's put on our scientific detective hats for a second.
If we know inflammation is bad for cancer recovery, how do researchers actually measure the inflammatory effect of our food in these massive trials? I mean, they can't just ask someone, hey, do you eat healthy, right? Because healthy is totally subjective. So to get hard, reliable numbers, researchers develop tools with these really heavy-sounding names, the EDIP and the EDII. Let's quickly de-jargonize this. EDIP stands for the Empirical Dietary Inflammatory Pattern, and EDII is the Energy-Adjusted Dietary Inflammatory Index. Basically, these are highly validated scoring systems. Scientists look at a patient's food frequency questionnaires and use these tools to literally grade a diet's inflammatory potential based on specific foods and nutrients. They're essentially giving our plates an inflammation score.
So what does this actually look like in practice? Well, when we contrast a high EDIP diet against a low one, a very clear picture emerges. A pro-inflammatory diet, one that scores really high on these indices, tends to be heavily associated with higher total calorie intake, a higher BMI, and generally worse clinical outcomes. On the flip side of that, an anti-inflammatory diet, which generates a low or even negative score, is predominantly vegetable and fiber-rich. It's packed with micronutrients that actively calm the body's immune response rather than agitating it.
Okay, let's move to Section 3, the colon cancer evidence. Let's look at the hard data.
Now that we know how they measure it, let's look at what happens when they apply these scores to real patients. We're looking at a massive Phase 3 clinical trial. It involved over 1,600 patients with stage 3 colon cancer who had already undergone curative intent surgery. Now, what's really interesting about this slide is the sheer magnitude of the impact. Researchers divided these 1,600 patients into quintiles, or 5 groups, based on their diet scores. For the patients in the highest pro-inflammatory diet quintile, meaning, they ate the most inflammatory foods, they saw a significantly worse overall survival rate. The hazard ratio was 1.87. In statistical terms, that means their risk of worse overall survival was nearly double compared to the folks eating the most anti-inflammatory diets. Just let that sink in for a second. The food they consumed after their diagnosis almost doubled their survival risk profile.
But wait, it actually gets even more fascinating. Prepare yourself for this absolutely massive statistic, 0.37. So the crucial point here is what happens when you combine these lifestyle factors. The researchers found a dramatic, synergistic survival improvement when a low-inflammatory diet was combined with high physical activity. And we're just talking about moderate exercise here, about 9 MET hours per week. When patients had lower EDIP scores and higher physical activity, their hazard ratio plummeted to 0.37 compared to the least active, most inflammatory group. That is an incredibly staggering reduction in the risk of mortality. Seriously, it's a game changer.
Notice how combining lower dietary inflammation scores with regular exercise actively attenuates the risks of cancer progression. It's not just about removing the bad stuff, it's about actively combining good, complementary behaviors. Doing this creates a biological environment that is incredibly hostile to cancer progression and highly supportive of overall survival.
Moving right along to Section 4, the breast cancer evidence.
So, does this principle hold true across different types of malignancies? To answer that, we turn to the PLCO trial. This was a major prospective cohort study tracking over 1,000 postmenopausal breast cancer survivors over a remarkably long period. And the data here is equally striking. When researchers applied that dietary inflammatory index to these survivors, the women consuming the most pro-inflammatory diets showed a 34% higher risk of all-cause mortality. And even more specifically, when looking strictly at breast cancer-specific mortality, that risk jumped to 47% higher for those on highly inflammatory diets. Again, we are seeing the direct, measurable toll that dietary inflammation takes on the body's ability to recover and survive long-term.
And this brilliantly illustrates the compounding nature of our daily choices. This focuses specifically on the women who are followed for more than 15 years. Over that long-term horizon, the protective benefits of an anti-inflammatory diet compound remarkably. Women in the most pro-inflammatory diet subgroup with more than 15 years of follow-up had a staggering 2.18-fold higher risk of death compared to those eating the most anti-inflammatory diets. It really goes to show that these dietary choices aren't just some quick fix. They are profound, long-term investment in your cellular health and survivorship.
Which brings us to our final section, empowering your cancer care. How do we take all this amazing data and actually use it?
So, we've looked at the biology, the measurement tools, and the hard data across 2 major cancers. Now, how do you apply this to your own life as an active partner to your medical team? Well, the actionable steps recommended in general oncology to lower systemic inflammation are beautifully straightforward. It really centers around high fiber intake and vegetable-rich meals. These are literally the bedrock of lowering your EDIP score. Combine that with regular physical activity, just like we saw in the colon cancer data, to create that synergistic 0.37 hazard ratio effect. But here's the most important part. These lifestyle tools are designed to be used completely complementary to your standard care. They do not replace your treatments, they support your body while it undergoes them.
Which leads us perfectly into this vital point from the complementary cancer library. The goal is to enable active engagement with your oncologist, adding complementary cancer care alongside your medical treatment where appropriate. Honestly, this is our ultimate goal with this entire explainer. This is not medical advice to replace your therapies. Rather, this is the hard data you need to have an informed, empowered conversation with your doctor. You bring this evidence to them and say, hey, I want to lower my systemic inflammation to support my treatment. Let's make a plan.
I want to leave you with this final provocative thought. The science clearly shows that your diet is not just passive filler. It is a profound biological dial you can turn every single day. So, if your daily meals could be an active partner in your medical treatment, actively helping to dial down inflammation and improve your odds, what will you put on your plate tomorrow? Thank you so much for joining me for this explainer. Stay curious, stay empowered, and we will see you next time.